My name is Dr. Robert Karanja. I work with Build Grow Africa, and we are members of CREED, the Coalition for Health Research and Development. We are very excited about UHC Day. Universal health coverage is not just a slogan or a word that we throw out there. It's really very much at the heart of what we do. For me, UHC really means how do we access healthcare, and looking at it not just from a perspective of finance, but also access in terms of the last mile distribution. Are we able to overcome barriers of distance, cultural barriers, and also barriers of not being able to access technology in itself, the supply chain aspects of it. The last part I think that that makes me stay awake at night is asking myself, do we have the appropriate health technologies for Africa that are designed with this market's needs in mind, and also that could actually make UHC not just do you call it a keyword or a slang, but a reality, because what we need is to address Africa's health challenges. We are 17% of the global population, but 25% of the global disease burden. So that is what UHC means for me.
UHC, to me, it's about everything about health, because it's about quality, it's about equitable access, it's about financial protection. As a country, we've made some progress, quite significant progress, let me say, and starting with the reforms within NHIF, which would be the vehicle, which is the most ideal vehicle for carrying taking us through the journey of UHC, or taking us to the dreamland. We've also seen quite a number of enrollment within the schemes after the reforms, and the bigger goal is to have everybody have a form of access. This is how I equate, or I foresee success in UHC. Just like the way you cannot drive a vehicle without a third-party insurance just to move it from point A to point B, to me success will be when a child is born, and besides the immunization that they first receive after being born, the next thing they get is a UHC card, a form of insurance. So to me, that will be how success will look like, and that's where the goal of UHC.
My name is Evelyn Kibuchi. I'm the Chief National Coordinator, Stop TB Partnership Kenya. To me, universal health coverage means that we want to remove the cost of access to healthcare from the patient to the government. That means that the patient should not, or the people should not be incurring high costs in seeking healthcare. We appreciate the fact that the government that was there previously had identified health as a priority and even introduced universal health coverage. However, I feel we still have a long way to go, that the UHC did not achieve the goal and the objectives that it was meant to. For example, I still find myself in so many WhatsApp groups that are doing fundraising for access to healthcare, huge bills. And with a UHC strategy that is working, that should not be. I am hoping we are going to change the strategy, improve on implementation of UHC, which will come through the government investing more in access to healthcare, including the county governments. And that way, I believe we can achieve the goals of UHC, where every citizen accesses healthcare without incurring any costs from their pockets.
UHC means, to me, it means affordability of services, equalization of services, accessibility of services. This calls for individuals from different economic level are able to access services without constraint. So for me, UHC means people being able to access these services without constraint, and that calls for the investment towards primary health care within the community.
So thanks. I think in the African setup, and specifically for Kenya, an ideal UHC would be at the point where for every Kenyan, or rather for every Kenyan will be able to understand what their rights are, but not only that, going further, to be able to understand what services they are eligible for in every setup or every level of the facility. Additionally, that is on the demand side. Additionally, from the supply side, we should be able to provide every service, essential services for every level of healthcare service provision in the country that is fully covered by the and financed by government through whichever financing mechanism, which for me, the tax mechanism would be the best, because there are many ways of ensuring that that is done as opposed to voluntary. And of course, making sure that we grow the UHC cube, the number of people who are covered, the services that are covered, and the amount of money that is covered. I think by the time we have a very clear roadmap on that, but additionally making sure that people have the essential services that they're getting, they know the services that they're getting in each of the levels of care, and additionally those levels of care are also capable of providing the quality and efficient services to that end. One of the ways that we can also really tap into measuring that is by looking at, are these services patient-centered? Are they provided timely? Are they efficient? Are they effective? And are they, I mentioned person-centered, and efficient. So it is important that we measure this within certain parameters from level 1 all the way to level 4 or above, especially if it's now UHC, we look at level 1 to level 4, because a huge percentage of our population acquire services within these levels of care.
So I think as a country, first of all, health is quite important, especially for a growing country. I know that most of us, we are just one health issue away from poverty. So health is one of the fundamentals that need to be taken care of, even by the new administration. So I will personally say that we've achieved much in that docket. When, of course, I hear them talk about the universal health care and especially the coverage on the National Health Insurance Fund. I would want us to achieve more so that the card is able to take care of major of the expenses that we undertake in the hospitals. So right now there's a lot of discrimination, even though we contribute to the card. Personally, I contribute to the card, but for somehow it's not been able to help me when it comes to matters health, because I have to be consulted whether I'm a civil servant or not. So the moment we get rid of those discrimination, I think we shall have achieved more in regards to universal health coverage. Yes.
It's whereby when I see there is primary health care, and this means that the community can access services and services can be availed to them, and also these services are affordable to all the community members. This means that the community do not really need to get a pinch whenever they want to access services that are supposed to be made accessible to them. And these services, are they accessible to the community? They might be availed but not accessible. So how are they availed to them, accessible, and are they able to afford these services? For me, UHC, it's all about putting the community at the center of all these things, at the center of all this design. So when UHC has been designed in a way that the community is at the center of it all, then at least I'll be able to sit back and say that the community can access all these services when they are laughing. Not that anytime somebody needs to access services, it's another pain on the back. Yeah.
For me, first of all, it's about primary healthcare service, because primary healthcare service, it's the common service that people go to in the health facility. Because anytime I get into a health facility, then I would like to see the drugs. Maybe I'm suffering from malaria or typhoid. then I won't expect the service providers to tell me, go out and go and buy such a drug for primary health service, I mean. So that is the first thing I would like to see. I would like to see a comprehensive, if it's a referral hospital, I would like to see a comprehensive services offered in that hospital. Yes, at the level 2 and 3 hospital, I would like to see that maternal care, comprehensive maternal care. If it is someone who is having disability, I would like to see that disability-friendly service in a health facility. So actually that is my expectation, and that is what we have been championing for and advocating for in Kisumu County, yes, as champions. Yeah.
So you would see, on my perspective as an advocate, one thing I will categorically say is that during the UHC pilot, we were involved in implementation of a project on UHC, but we realized there were a number of gaps in terms of the UHC did not capture some of the important components like the sexual and reproductive health and even mental health. So one thing that we'll be able to see for us to achieve this is invest in the community health strategy, that is investing in the community health volunteers. We find that for UHC to be achieved or primary health care to be achieved, we need to invest on the link, because you find that the community health volunteers plays a very critical role in ensuring a linkage between family units and the facility. And you find that the UHC is designed in that it wants to decongest the higher tier of facilities, like the facilities level number 6 and 5 and 4. So that is one thing that we need to invest and ensure that we invest in upscaling, maybe paying salaries to these CHVs so that they can be able to do their work well, capacity building them to ensure that they can be able to offer basic medication, and also just ensuring that data is a key, ensuring that we have a data, and also in terms of referral, we need to digitalize that referral system so that we can be able to trace the history of a patient before the patient has been referred. Thank you so much.